Hi, I'm Gary White for Central Kentucky Television. I'm here with Dr. Trish Sacconi, who's with Central Kentucky Optometric Associates. They have offices in Lebanon and Springfield, and this is our Eye Care News segment. And since school started not too long ago, we have a lot of issues. You were saying that most of the learning that children do actually comes through their eyes. They read or see, or that's how they learn, right?
That's correct. We're back to school now, and well, Kentucky's been back to school for about a month. Most of the nation has gone back to school this week. But studies have shown that learning is about 80%, or learning is all about vision really. 80% of what a child learns in school is presented to them in a visual fashion or a visual manner. Studies show that only 31% of children ages 6 to 16 have an annual eye examination, and 70% of children under 6 years old have never had an eye exam. The result of these statistics is this is a nationwide is that 1 in 4 children go back to school this year with an undiagnosed visual problem that could interfere with their optimal learning. So you know, that's pretty staggering statistic.
Absolutely.
In this day and age when eye care is really accessible, and it should be accessible for everyone. We have an advantage in Kentucky in that several years ago the state legislature initiated the requirement that every student entering public school in Kentucky was required an eye exam before they could enter public school. The Archdiocese of Louisville and the Archdiocese of Lexington, the Catholic school system has also followed through with that and are requiring their students, at least when they enter school, to have an eye exam. And sometimes, you know, more than not, it's not always the kids that have the real obvious vision problems that get missed by screenings, and that it's the kids that have these marginal visual problems that sometimes wouldn't get picked up without the eye exam, and so there's a large segment of those kids you know, that we are picking up now.
Yeah, and it's great that we have that exam requirement before you enter school. However, we were saying that ideally it would be great to start eye exams for children by the age of 2, correct?
Yeah, really. When we're born, our vision is not fully developed. We don't see 20/20 when we're first born. And the vision has to develop, and it requires good stimulation of both eyes to get good 20/20 vision in both eyes. And those years when you're between the years of 1 and really well from when you're first born till 3 and 4 years old, that's when your acuity is developing. So if you wait until a child is 5 or 6 or entering kindergarten, sometimes it's too late and you can't reverse the effects of a lazy eye or of the lack of development of an eye, which is called amblyopia. If you can get to these kids much earlier, when they're you know, 2 and 3 and 4 years old, sometimes, you know, you can have much more effective treatment through patching and correcting the refractive error or correcting the strabismus. You just get a better prognosis and outcome for the child the earlier you can get to that child. So sometimes while that preschool and kindergarten screening and required vision exam is really important and has been helpful in identifying a lot of children, we really need to get to kids earlier so those that do have those problems can have a better outcome.
So by about 2 years old, it would be best to be into the doctor to get
Yeah,
that exam going.
that's generally what we recommend. And if you see anything going on, even when they're under a year old, you know, we're going to do an exam on them. It's not going to look like the same exam that we do on, you know, a 10 or 12-year-old child or an adult. It's going to look very different, but we're going to really evaluate. We're going to make sure that the eyes are physically healthy. We're going to make sure that the child has good binocular alignment and is getting good binocular stimulation, and we're going to make sure that there aren't any overt refractive errors. Anything that needs to be addressed to promote that optimal visual development.
Great. Now, we talked about school, and you do learn through school, but also a big part of school for a lot of kids is the athletics.
Yes, and 1/3 of all sports-related eye injuries each year are suffered by children. Sports are the leading cause of eye injuries in children under 16. And we need to really probably do a better job of getting the word out there that most of these sports do require optimal vision and optimal protection to protect your eyes.
So you can come by Central Kentucky Optometric Associates and find out what some of that eye protective wear is, because you have that here, correct?
Yeah, you know, sometimes sports goggles, whether they're prescription or whether they're plain, or sometimes a sports goggle is really in need, or a shield on a football helmet might be a good thing to do, or a pair of impact-resistant sunglasses for somebody who's on a baseball field. If you are a swimmer, there's sports goggles that you can wear. Sometimes you're actually maybe safer wearing contact lenses as opposed to the glasses. So we're going to take each individual sport and each individual patient and find the best way for them to keep their eyes healthy and protect them from injury.
Right. So we're thinking a lot about the young people this time of year, because school is in session again. And with them in the classroom, but also out of the classroom on the field, to make sure they keep their eyes safe and protected.
Yes.
All the time.
And we see kids from all ages. You know, we'll see them from infancy, you know, to adulthood, in all ages, all sports. We're going to find and all different problems. We're going to take care of anybody who needs taken care of.
Another thing, even though summer is not officially, but technically over. People kind of think sunglasses aren't as necessary anymore, but even in the winter,
sun shines all year round, and that ultraviolet light is there all year round, and we all should be wearing protection all year round, not only to protect our eyeballs and our retinas and the internal structures of our eyes, but also to protect our eyelids and the skin and tissue around our eyes from UV exposure, and decrease the risk of skin cancer in those areas.
So all those people out there watching all those sporting events, the grandmothers and
if you're going to sports watching,
make sure you have those glasses.
That's a good point. That's a good point, Gary. Yes.
Well, thank you very much. Again, I've been talking with Dr. Trish Ciccone, who's with Central Kentucky Optometric Associates, offices in Lebanon and Springfield. Give them a call. They'll be happy to consult with you. This has been Gary White for Central Kentucky Television.